Good afternoon. Thanks for having me here. I work in the Department of Orthopedic Surgery with an orthopedic surgeon that primarily does hip and knee replacements and some other procedures around the lower extremities. Things that I deal with on a daily basis are things that you likely will not see on your boards. What you will see on your boards are going to be orthopedic problems that you would encounter in a primary care office, things such as carpal tunnel syndrome, tennis elbow, rotator cuff problems, meniscal tears, all of what we're going to discuss over the next 75 minutes. So keep that in mind when you do study. There is a lot of information that I have to go through here, and I am only given a lot of time for all the information. I'm going to go through things very quickly, and sometimes I'll spend a second or two on a slide intentionally. I'll spend a little bit extra time where I think it's needed, but we will go through things very quickly. There's just no way I can get through everything without going through things very quickly. I have no disclosures. There's no I don't have any relevant financial relationships or off-label use, of course, with any of the material. So here's what we're going to talk about. Basically, starting with the shoulder, we'll go from the head all the way down to the toes, including the spine and back, as well as some pediatric issues and pediatric orthopedic problems that you should know for your boards, as well as maybe some hernias that if we have time for. Here's some other things that I will not have time to cover and should have been covered in other lectures, and ID, rheumatology, specific osteoporosis treatments, and osteoarthritis. So we always start with a H&P, history and physical, with any problem, whether it's orthopedic or not. Onset, location, duration, what makes it better, what makes the problem worse. Did this happen last night, or has the symptom been going on for the last 10 years? All important to know. The character of the injury. There's, of course, specific questions you'll ask for the specific orthopedic musculoskeletal problem, which we'll go through for your boards, and what their function was before the injury, of course, is always good to know compared to what it is after the injury. Physical exam, inspection, palpation, range of motion testing. We do a lot of range of motion testing, motor, sensory, muscle testing in orthopedics. There are quite a bit of special tests that we will do depending on the orthopedic problem. And we'll go through all the special tests that I think you should know for your boards. And this, just by inspection, just by watching the patient walk, getting up from a seated position, standing, walking across the room, getting back into the seated position, you can tell a lot by their gait pattern and how they move about, whether it's a back problem, hip problem, neuromuscular problem. Here's some terminology just to review. Abduction, you should know this terminology for the boards. Abduction is moving away from the midline, and adduction is moving toward the midline. A ligament connects two or more bones or joints, and a tendon connects muscle to bone. A sprain is a stretch and or tear of the ligament, and a strain is a stretch and or tear of the muscle or tendon. Malunion is healing in an unacceptable, undesirable position, and non-union is no healing at all in the fracture.